morning. Today we have here in Fascia Manipulation Institute Dr. Antonio Stecco, a specialist in physical and rehabilitation medicine, assistant professor of New York University School of Medicine.
Thank you. Thank you for the invitation.
Can we do you some question about your research?
Of course, also a pleasure for me to introduce the research that we are done and we are doing now.
Okay, there is a growing interest in fascial and neurological symptoms. Is there any clinical proof of the efficacy of fascial in these conditions?
Well, we have saw that neurological problems generate a peripheral alteration. And on top of that, we saw, for instance, like spasticity, we need a peripheral alteration in order to generate spasticity. So until now, it was thought that all the spasticity, all the alteration that we see in the periphery, like a contraction or retraction, was only due to the central lesion. But then we understood at the same time that that happened even 12 months after the event. So that cannot be due to an alteration, an evolution of the central lesion. This is why we found that there is necessary also peripheral alteration. And we saw that the capsule and the muscle spindle is part of this problem. So in order to have spasticity, you need a central lesion, stroke for instance, plus what we call densification, so an alteration of the environment where the muscle spindle are localized.
We have seen you with many different Major League Baseball teams. Is this a sign that First League teams are more and more interested in fascial manipulation and more in general in prevention and biomechanics?
Yeah, that's true. So as time goes on, we in all the sport team have saw that there has to be set up a sort of prevention. So all the athletes, they have a long career. So we talk about like baseball, like pitcher, that can have like a 10-year career, 10 years of contract where they have to play. So it's really paying back to invest money to prevention, to analyze at the beginning of the season how mechanics is doing, how the coordination of the motion is doing, because that is the best time to assess the patient, or the athletes in this case, understand what is wrong in the biomechanics, treat at that time of the year the athletes in the way that the season will go smoothly, and you will not have to face major symptom or syndrome at the end of the season, maybe at the playoff, when there's a lot of stress, there's a lot of expectation in the player, and of course the season have make a lot of repetitive injury or overuse. So this can be really seen in baseball team, but as well like in tennis player, golf player. So all the game where you have like a repetitive overuse, and maybe not a major direct impact. But we have published an article about sport injury prevention in soccer player. And we really see with a follow-up at the last 12 months that we drop dramatically the major ankle sprain. So the injury of the inferior limbs, that is the most common area where the injury will occur, they really just drop. The study group that have had the 3 treatment of fascial manipulation didn't have any ankle sprain that lasts more than 2 days. The control group have like 5 major, like 50% of the athletes have a major or minor ankle sprain that have to, quit the people, keep the athletes from activity for at least 6 days up to the entire season.
And as assistant professor of New York University School of Medicine, how overseas has this new role of fascia in the human body and being?
Well, fascia is growing interest in all the field. So in medicine, it starts to be really recognized as the major origin of myofascial pain syndrome. So in the past, muscle was like the origin of myofascial pain. We remember Trevor and Simons. But it's funny that in the Triumph of Simon's books, there's no one citation, one sentence about fascia. Now it seems almost the opposite. So fascia is growing up the importance. Why is that? Because fascia is really well innervated. And we saw that the innervation, it's mean relation with pain generation. So as soon it was worldwide agreed that the fascia is one of the major tissue about innervation, sensory innervation, okay, that from there, fascia became one of the major targets to analyze pain. But on top of that, we know that fascia is a major load transmission force in mechanics. So we know that at least 30%, but can be also 80% of the muscle force can be transmitted through the connective tissue, to the fascial system. So this is why, even if you study biomechanics of the body, you need to take into consideration the fascial system. And from there, we go to the proprioception. And of course, then to other neurological important characteristic of our human system. So it's true, that is a major growing and still a process going on.
It is known that you have been to many countries around the world to teach fascial manipulation. How the different continents approach this technique? Which difference do you see?
Well, luckily, fascia tissue is something that it can be identified. So you can present this tissue, and you can really let the patient or the participant understand what is the rule, okay? Because unfortunately, in all the anatomy books, sometimes it was just take it off to show the muscle. But when you start to present like a real anatomical picture of an embalmed dissection, you can really see this continuity, this correlation between different body segments, between muscle, synergic muscle in different body segments. So we are able to present this method, because it's not just a technique, it's a method of fascial manipulation, it's a method to assess, make diagnosis, and also treat. And of course, the people worldwide are getting exciting because you see instantaneous result, but the most important part is that you give a long-lasting result, that we have proved with a randomized controlled trial with a 3, 6, even 9-month follow-up. Then of course, every culture has a different approach. So in West country, the scientific approach that we have developed is really appreciated because it permits to have a clear guideline how to assess the patient, how to make diagnosis, how to select the area that has to be treated. And of course, it's always a combination related to the biomechanics. In the East country, where acupuncture, traditional Chinese medicine is really strong, they still really love the method because really merge with their knowledge. So we always say that the fascia is like connective tissue that connects East and West medicine, because really the fascia can explain the acupuncture meridian. So the continuity that they really see clinically from thousand years, but was never explained with a Western point of view. And also the approach can be different, because I say this is a method. So in China, they use a lot of needling to treat our point. In other countries, they use a shock wave to treat our point. But so far, the manipulation is still like the best, because you have at the same time a feedback about how the tissue is changing during the treatment and how far you have to go with the treatment before to have the result. And of course, it's the cheaper way and the easy way to treat. So that is why we have a lot of good feedback from different countries worldwide, and we are still growing.
Okay, thank you so much for your time.
Thank you for the invitation.